It's heartwarming to it's heartwarming to know that the medication is still free, and we have centers spread all over Nigeria. But my concern is the education, the HIV education. It has dropped drastically, and our Gen Zs now, a good number of them, do not even understand what HIV is. Isn't that dangerous? And what about the NGOs? We used to have a plethora of them, all of them talking about HIV, going to the hinterlands and doing a fantastic job. The numbers have drastically dropped. What is NACA doing to revive this?
Thank you. It's part of why we are here today. And we've actually been up and about, and we are interacting very, very closely with the youth. For instance, during the course of this week, that's just an example. Today, we have a whole day dedicated to the youth. We have youth from across Nigeria that will be joining me. We're going to have some panel discussions and all. On Saturday, I'll be on X, the former Twitter space, discussing HIV with the youth. We work very closely with Association of Young People Living Positively with HIV, which is the patient community themselves. We have youth-friendly centers across some of our institutions here in Nigeria. We work very closely, like I said, with youths from institutions, right from the secondary schools, from the higher tertiary institutions, and we use the social media. As NACA, we have a TikTok account, we are on Facebook, we are on what do you call it now? Other, in X and other social media platform, because we know the youth, they are very active and visible on this platform. We churn out prevention messages, we use music, we use drama, we use kits, and so many other things that they can relate with, and we are not doing this alone, actually. We are working with a lot of private sector entity, that have very good followership. We have influencers, that we have adopted as ambassadors on there, and they help to promote some of these messages on their platforms. We have other government agencies. For instance, we work very closely with Nigeria National Orientation Agency, NOA, and sister agencies that like that, information and all, to ensure that we amplify these messages and continue to promote the message of prevention. The good thing is that as we speak, the prevalence of HIV in Nigeria is 1.4%. And that means about over 98% of Nigerians are still negative. But you are very right, because the most vulnerable people are the youth, the young people, particularly the young women. So we need to actually be very aggressive in educating them so that they continue to remain negative, particularly now with so many risky sexual behaviors out there.
Let's talk about